It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good afternoon, and what's a beautiful Saturday afternoon compared to what we've had the last couple Saturdays. So I hope you're out and enjoying it, and thank you for tuning in, listening to the Kim Hammer Show. I hope that you'll get something beneficial out of this. I know you will, because I've got Senator Missy Irvin on. We're going to talk about ARHOME. That is going to be Senate Bill 410. Senate Bill 410. If you want to look that up while we're talking, you can go up to the state website and find that. It's goes up. You go up to www.arcleg.state.ar.us. That's www.arcleg.state.ar.us. And when it pulls up, it's going to have a picture of the Capitol, and up there in the left-hand corner, it'll say "Search for Bills." Just type in SB 410, and that'll pull the bill up that we're going to be talking about today with State Senator Missy Irvin. And then in the second half of the hour, I've got State Representative Les Warren, who's going to be calling in, and we are going to talk about Work and Save. It's a piece of legislation that he filed this week that's going to make it easier for working Arkansans to be able to save toward their retirement. So when they retire, they won't have to be totally dependent upon Social Security. I think you're going to enjoy what you've got to hear when Representative Warren gets on the line the second half, which, based on what I just heard on the news, you probably need to have that, because thanks to our Congress, we are now going to be right at $2 trillion more in debt because they passed that COVID package, while they still had around $1 trillion sitting around somewhere out there that they didn't find or spend from the last one. So good job, Congress. Deep thinking. All right, let's get on to something more positive. Senator Missy Irvin joining us online. And Senator Irvin, thank you for joining us on the Kim Hammer Show this Saturday afternoon.
Thank you so much for having me, Senator Hammer, Kim, and I just appreciate. I'm actually outside at an auction in Mountain View, Arkansas, enjoying the beautiful weather, and just so happy to join you to be able to discuss Senate Bill 410, which is our home, Arkansas Health and Opportunities for Me. So just excited to dive right in.
All right, good deal. And tell everybody, first of all, what your Senate district is. You've got a pretty large geographical district, so they know where you are.
Yes, I represent Senate District 18, which is basically the north central part of the state of Arkansas. I have northern Faulkner County, parts of White County, Pangburn, Center Hill, Latona, and then I also have, and in Faulkner County, I have Guy, Enola, northern part of Greenbrier, and then I go up to Cleburne County, and all of Cleburne County, all of Stone County, all of Searcy County, half of Baxter County, half of Fulton County, and portions of Van Buren County, including Fairfield Bay. And then I have a bite out of Marion County. So I have the Buffalo River, the Greers Ferry Lake, Lake Norfolk, and just the Red River, the White River, and all the great stuff. So if you want to come fishing, hiking, mountain biking, my district's the place for you.
And you do have a great district up there, and Senator Irvin does work hard for a district, especially on the Buffalo River, protecting our natural beauty there. So I just want to give you that shout out for that. All right, let's get on to Senate Bill 410. This is a bill that you and Representative Michelle Gray, who was going to be on the radio, but she had an obligation, and she may actually call in a little bit if she can get free from that. But this is a bill that you and Representative Michelle Gray have filed. It is Senate Bill 410. Talk about it from the 100,000-foot view, first of all, and then let's get into some specific questions.
Okay, sounds great. So 7 years ago, Arkansas negotiated with the federal government a program to expand our Medicaid program. At the time, we only covered people that were 0 to 17% of federal poverty level. So just to round it off, if federal poverty level is $10,000 annually, then we only covered people that made an annual income of $1,700 on our Medicaid program. So we had a large population between that 17.1% up to 138% of people that weren't going to be covered and under, the insurance exchanges that were put in at the federal level. So Arkansas had an opportunity there, and what was negotiated 7 years ago was to allow for a Section 1115 waiver, which was in actually the federal legislation. And that Section 1115 waiver allows us to basically create a new program and be innovative, just like we see states doing all the time. And so we actually purchased and partnered with private health insurance companies within our state of Arkansas, and a new one actually came in too, to provide premium assistance and buy premium insurance plans for those individuals. We were able to do that to negotiate it with the federal government, where they paid 100% of that program for us. And then it went down to now as a 90-10 split. So what Senate Bill 410 does is build on that financial policy that was put in place 7 years ago under that initial legislation. And then after that initial legislation came Arkansas Works, which was our ability under the Trump administration to require a work engagement. And the reason I think that's important is, individuals that are in any of our programs, we want to make sure that we're working with them to get them to the next level and to a better paying job, or a job that does have private benefits or health benefits. And so that work engagement is really to try to help an individual be more successful in their life and to find, better work. So maybe if they're not working, to help them find a job, but also then to find better work so that they can make more money, be more successful, be more productive. And I think that's important. I think ARHOME, the new program under Senate Bill 410, is really the step 3 and kind of the final phase, because we were actually able to get the claims data from that insurance program. And what we saw was there's so many diverse people within this program. And so what Arkansas Health and Opportunities for Me, which is ARHOME, it's designed to be intentionally designed to meet that individual where they are and help them through their life. And so we know that one size doesn't fit all. And so this gives us the opportunity to go back to the federal government and say, this is what we want to do. We want to design a program based upon the Arkansas citizen and on that individual, and to really address where the needs are in the state of Arkansas, where we see that we are slipping behind and not meeting good health outcomes for our citizens. So ARHOME is really designed to use that same financial policy that was put in place 7 years ago, and which is a 90-10 federal match, which pays our providers, our hospitals and doctors, a lot more. Utilizing a private health insurance plan actually helps pay our providers between 25 to 65% more in reimbursement rates than the traditional Medicaid plan. So that opens the door to increased access for our Medicaid patients so that they can seek maybe more specialized treatment and help with some of those folks that have those higher instances and needs. So ARHOME uses that same financial policy, which has been proven to be successful over the last 7 years. And then it combines with a health policy, like I said, that's tailored to the individual. And so I want to talk a little bit about that. But the most, I think it's important for folks to understand and to know that this program has successfully, the financial piece of it, has successfully brought in billions of dollars of federal revenues. And although I know that we say, and I'm a person that believes this too, the federal government, we, like you said, the debt is just unbelievable. But what they've done at the federal level is they've shifted that money away from Medicare reimbursements over into the Medicaid bucket. And so, it's important and responsible for us to support our rural healthcare infrastructure in the state of Arkansas to really understand that dynamic and go and get those dollars that are really supposed to come back to our state. And that supports our healthcare infrastructure in the state of Arkansas, and it stabilizes that healthcare infrastructure. And that's incredibly important. So I'm going to take a breath there and talk a little bit more about why the financial piece is important, and then go into the healthcare policy of it.
Let me ask you a question before we do, because we want to kind of be holistic and look in our approach, because there's different opinions about what we're doing as a state as far as dealing with the Medicaid population out there, which the Medicaid population is the Medicaid population no matter what we do. Where some of
Right.
this conversation started years ago was the impact that it was having on rural hospitals and providers not wanting to see Medicaid patients because there was no reimbursement mechanism that was sufficient for the cost of providing the need, but also the fact that people were showing up in the ER as uncompensated care to the rural hospitals. Before we kind of go down in the weeds, and I'm gonna ask you to talk about each one of the components of ARHOME because it deals with the the women that are pregnant. It deals with
Yeah.
other aspects, and talk about those individual components. Talk about the comparison of fee for service versus what's being proposed in ARHOME first.
Yes. So the Medicaid fee for service, which is the traditional Medicaid program, is a very limited benefit. And the reason why is because it requires more of our state general revenues to fund. And so the rates that we pay in that are very, very, very low. And so providers and hospitals, particularly clinics, they really have to maintain a smaller portfolio of being able to serve those patients. You could be the busiest doctor on the block or healthcare provider or hospital on the block, but go under if they were all Medicaid patients. It just doesn't pay enough. I mean, you could see 20 times the amount of patients, but because it doesn't pay, you would literally go under. You would not be able to pay your bills. And so I think that's one of the key components of this is that we were able to purchase a private insurance plan which pays between 25 to 65% higher rates than the normal fee for service does. And that is incredible. That right there, that one financial component has literally helped keep all of the rural hospitals in the state of Arkansas, all except for one, open. And if you look on the map in the surrounding states around Arkansas, there have been 57 rural hospitals that have closed in the surrounding states around the state of Arkansas. And Arkansas is this big island where we see a strong, stable rural healthcare infrastructure that's in place. That is incredibly important for so many reasons. So if you look at the critical access hospitals, number one, it's life-saving. So if we can get you to a hospital as quickly as possible, we can stabilize that patient, and then we can helicopter them or transfer them to a bigger hospital that has an ICU component or the specialists that are needed. But those critical access hospitals are incredibly life-saving hospitals, and they're really important throughout our state. They're also huge to the local economy. I mean, right now I live in Mountain View, Arkansas. So Stone County Medical Center is the number one private employer in our whole entire county, and the second biggest employer would be our school system. So, they're incredibly important to their local economies, and 40% of Arkansans live in rural Arkansas. So there's a whole. I'll talk about the Life 360 homes in a minute. But those rural Arkansas, rural critical access hospitals are just, they're so important. And why are they important, especially right now? This is a point that, really hit me last March when we got hit with COVID. COVID, we had to increase our ICU bed capacity in the state of Arkansas. We increased it by 19%. The only way we were able to increase that ICU bed capacity was counting and using all the beds in the state of Arkansas, which included all those rural hospitals. So, we were able to take care of our COVID patients so much better than other states where they saw those rural hospitals close their doors. So, just incredibly important to know that our entire healthcare infrastructure is so important to meeting the needs of our citizens. And so that is a huge difference between the fee-for-service and the insurance plans that we were able to purchase. And we literally would take total, it's about $9.67 billion if this plan goes through for the next 5 years to that infrastructure. And if you went fee-for-service, you would be ripping $3 billion out of that infrastructure, and the hospitals would close.
All right, let's talk about the major components of what goes into ARHOME and the populations that you're trying to address through it.
Yeah, so I'm so excited about ARHOME and like I said, Arkansas Health and Opportunities for me. So it's about me. It's about what I'm dealing with in my life, and so it's not a one-size-fits-all approach. And so, we have strong financial policy that we're building on. Like I said, good negotiation with the federal government to get us there. But the ARHOMEs are designed to meet the people that are beneficiaries. So I'll start with maternal. The maternal Life 360 home is directed towards women who are expecting babies. And it's to go in and ensure, and this is a partnership with the insurance companies. They're going to be accountable to these goals that we're going to meet and set, and metrics. Financially, they're going to be accountable to it. And so we know that that there was less than 60% of our women that were on the program utilized healthcare in the first trimester. And that's a problem. That first trimester is really critically important to the development of that brainstem of that baby, and the overall development, but particularly the brainstem and those functions. And so it's so important that women seek prenatal care in their first trimester. It's also important to make sure that women know it's dangerous to drink alcohol in that first trimester, or to work with those expecting moms, if they have a substance abuse problem, to help them get help that they need, because it's about the life of that baby in the womb. And we have such a high percentage of low birth weights at birth. We have a high percentage of babies that are born with just lots and lots of complicated issues. About 21,000 babies are born under the Medicaid system, and 2,100 last year, about 2,100 babies require a stay in the NICU, the neonatal intensive care unit, which is incredibly expensive. All of these low birth rates, high-risk pregnancies, stay in NICU, that costs the state of Arkansas about $100 million annually, just that one component of the health care that we cover and pay for. So if we can go into that expecting mom early on and work with her to ensure that she has great prenatal health, that's going to lead to a healthier delivery and a healthier baby. Arkansas right now ranks 49th in maternal and infant health outcomes. That is pitiful. We have to do better. This program is designed to improve that. That will help our mothers and help our babies come into this world without complicated health problems. I love the maternal Life 360 home. And when I say Life 360 home, there's so many programs out there that we need to connect people to, that are programs that are already in existence, either through the federal government or through the state government. So the Life 360 home healthcare policy gives us that opportunity to bring all of those services to that person and to help them get through what they're doing. The second one, which is super close to my heart, is the Rural 360 homes. And I've lived in rural Arkansas, and my husband practices medicine here in rural Arkansas for over 20 years. And the rural folks in the state of Arkansas have poor health. They have a higher mortality rate. They have a higher morbidity rate, which means that they have lots of different illnesses, lots of chronic congestive heart failure, chronic cardiovascular issues, diabetes, obesity, smoking, substance abuse disorders, mental illness. And so the Rural Life 360 home is really to target and to really create a rural health initiative that is robust, that is intentional, and that is directed to the needs of the rural Arkansans. And so that one, close to my heart, because it's been what we've been about for the past 20 years, practicing in rural Arkansas and practicing medicine here. So the Life 360 homes are going to help those folks in rural Arkansas address all of those different needs that they need. And then the last Life 360 home is called the Success Life 360 home. That one is directed and targeted towards our veterans who we know have complicated issues, both in their physical health and also in mental health. So we have about 5,000 veterans that are currently on our Arkansas Works program, which will be transitioning into ARHOME. So it's really an opportunity to connect with all of our veterans organizations and to help those veterans with all the different needs that they have. Also in the Success Life 360 homes are the youth that were formerly part of the DYS system that were in custody. We know that those kids need extra help and extra attention, and it's designed to bring all those programs to them. Also, those that were in the foster care system, we know that we can reach them. And then about 17,000 on Arkansas Works were formerly incarcerated. So if we can, target that population and help them, our goal is to try to decrease our recidivism rate, to prevent them from going back into prison, and to help them, get back on their feet, get to make sure that they have work and that they know how to take care of themselves, and to help them transition back into life and to be successful. So those Life 360 homes are intentionally designed around the population that we have currently in Arkansas Works that will go into Arkansas Home. And it's just a holistic approach. And it's the right approach. Why do we spend the money if we're not actually going to do something with it? If we're not going to improve health outcomes, then why should we do it? And I think that's the big question that a lot of us were asking on how we need to redesign this program to be that holistic approach.
So let me ask you, if you can hang on, we got about 2-3 minutes. I'm going to take a couple minute break, and then we'll come back out of the bottom of the half hour for about 3 or 4 minutes. And then Les Warren's going to be joining me. So let me ask you, how is this actually going to save money? Because this started back in 2011 when we, passed the private option. Then we did the Arkansas Works, which the problem with the Arkansas Works was you got the federal government that ruled you can't attach work to a requirement. That wasn't our choice. That was imposed upon us by the federal government. So how is reconfiguring and bringing the 360 homes into the scenario actually going to save us as a state money, set aside from the matching that we're getting, pulled down in federal dollars? How else are we actually going to see savings that people could point to and say, this is why it's really working as opposed to what we've been doing different?
Well, we now have access to the claims data. So we can actually look and see, and you can look at how they're using their health care. So if you can prevent somebody from going to an emergency room and going to their clinic instead, you're saving money. If you can work with a pregnant expecting mother and prevent a high risk pregnancy and a low birth weight baby, and prevent a stay in the NICU, you're saving a ton of money. If you can keep somebody out of prison from going back to prison, you're saving a ton of money. So, and the same with the DYS. I mean, if you've been formally incarcerated in DYS system, then, the chances are there's a high percentage that unfortunately you'll end up in the prison system. But if we can go in intentionally and work with that individual and help them seek the right care at the right time, it saves money. And we know that this happens because insurance companies do this already. Self-insured plans with their employers do this already. So, it's really bringing about all of those things that are working out there into this actual program, and then being intentional about it and setting those metrics and those health outcomes and those goals, and then making sure we're accountable to meeting them. And I think that is a huge portion of it. But then also back to your point, the uncompensated care payments that we had to pay under before we did any expansion were tremendous. But they weren't even enough to cover the losses that we saw at the hospitals. And then there were no uncompensated care costs or payments to any of the doctors or nurses that are out there in the clinics providing the care. They just had to eat that, and they couldn't even write it off. So, I think at the end of the day, there's going to be a lot of savings realized in a lot of different ways, but the overall savings is really going to come from being able to shift folks from that 70-30 match into the 90-10, being able to be intentional and targeted to work with them to prevent some of the poor health outcomes that we already see. That is what's going to save us money, but it's also going to save lives. I mean, it's going to save a life if we can prevent a baby from staying in a NICU, or if we can prevent a baby suffering from fetal alcohol syndrome, or if we can prevent a baby being born into the world already addicted, to illegal drugs. That saves money. It also saves a life.
Okay. All right. I got to take a break. And here's the question I want you to think about when we come back, and we'll kind of wrap it up because I got to get to Representative Les Warren. Then we're going to talk about Work and Save, which is really kind of a complement to what we're doing over here on this side, and that it's creating opportunity for individuals that otherwise might not have an avenue to save, to be able to help build a retirement that can complement their Social Security, because so many people retire dependent upon Social Security only, and it's not enough to get it done. And so another innovative idea coming into the mix that Representative Les Warren is going to talk about the second half. All right, I've got Missy Irvin, State Senator, on, and we are talking about ARHOME. And if you wanted to look that up and look at the website, get the copy of the bill, which is Senate Bill 410, you can go to www.arcleg.state.ar.us, pull up the bill. You can read through the content of it and get informed on it. You're listening to the Kim Hammer Show here on 101.1 FM, The Answer. I want to give a shout out to Carrie Murphy with Murphy Productions. They're having their gun show down at the Benton Event Center today. It goes till 5 today, and then tomorrow from 9 to 4, go to church first. Get 9 to 4, and that's at the Benton Event Center, Carrie Murphy Productions. We'll be back in just a minute on the Kim Hammer Show to finish up with Senator Missy Irvin.
Come show the state that Arkansas is pro-life at Arkansas Right to Life's 43rd Annual March for Life, Sunday, March 14th, 2021, 2 p.m., West Capitol and Wolf Streets in Little Rock, behind the state capitol. Churches and families are encouraged to attend this peaceful and prayerful observance of the Roe v. Wade decision that legalized abortion in our nation 48 years ago. To volunteer or for more information, call 501-663-4237. The Heart of Arkansas beats for life.
Hey, it's Steve from 93.3 The Fish, and I'm a client of Pat Davis, yourhealthplanman.com. I'll be honest, I was skeptical when I first heard Pat talking about getting paid to go to the doctor. Sounded too good to be true. But as I got to know Pat, I decided to put those fears aside, and now I am one of his many very happy clients. I went to the doctor recently. My bill was $76. A few weeks later, I got my bill from the insurance company. It was paid in full, and are you ready for this? I got a check for $180. When was the last time you went to the doctor and couldn't wait to get your bill? This happens all the time with Pat Davis, yourhealthplanman.com. He could put you on a plan all year round. It isn't too good to be true. It's exactly how Pat says it is. Give him a call and see if he can save you 30 to 50 and even more % on your premiums. What an affordable alternative to the Unaffordable Care Act. And best of all, this is health insurance and not just supplemental or a share plan that are not health insurance and have no guarantees. So call Pat today, 501-605-6935. That's 501-605-6935.
Imagine doing one thing that gives you an entirely different perspective about your place in the world. Think it would be worth it? Hi, it's Mike Gallagher, hoping you can join me for a 10-day Stand with Israel tour through the land of Israel, October 2021. Join us. Get firsthand insight into Israel's fascinating past and promising future. We'll learn about the geopolitical, economic, and spiritual dynamics of one of the most fascinating countries on earth. But you'll share experiences that'll change how you read Scripture, walk the ancient temple steps, touch the Western Wall, sail on the Sea of Galilee, pray on the Mount of Beatitudes. The list goes on and on. Return home inspired, renewed, and empowered. Now listen, if you've ever dreamed of seeing Israel, this is your chance. Join me October 2021, and right now register worry-free. Peace of mind, guaranteed refunds up to May 8th if for any reason you want to cancel. So to come along, call 855-565-5519, 855-565-5519, or go to standwithisraeltour.com, standwithisraeltour.com.
101.1 FM. The Answer.
Welcome back to the Kim Hammer Show here on 101.1 FM, The Answer. If you're watching Facebook Live, thank you for joining us here on a beautiful Saturday afternoon. One thing I just wanted to share with you also is that if you want to check out my website, you can go to www.thekimhammershow.com, thekimhammershow.com, and we have some publications that have been put out on the bill that we're talking about, Senate Bill 410 by Senator Missy Irvin and Representative Michelle Gray about ARHOME. We'll try to get that up on the website. It may be Monday, but we'll try to get up there so you can take a look at it. I want to give a shout out to Murphy Productions and remind you that he's got his gun show going on today in Benton at the Benton Event Center. Get the take the Congo exit if you're coming out of Little Rock. Just stay on the service road. You'll go down there to the Benton Event Center on the right-hand side. Goes till 4 o'clock today. Till 5 o'clock today, or tomorrow, 9 to 4 after you go to church, 9 to 4 tomorrow. All right, so let's finish it up with Senator Missy Irvin. I didn't give you the question. Sorry, I was squeezed up against the break there, and I didn't give you the question. So here's the question I want to finish up on. So much of what we do as a state government is dealing with people trying to provide resources, and there's that ongoing debate of how much do we as a government step in and run people's lives, and how much are we responsible for, to the point that we got to spend the tax dollars that we do helping individuals, maybe because of irresponsibility on their part. And that is always a battle, especially among the conservatives, as far as how much is enough and when have we gone beyond what we should be doing reasonably with the taxpayer dollars. Fee-for-service, Medicaid, we only get a 70-30 match if we go that route. This way we get a 90-10. We pull down more federal dollars. So just give us your final thoughts in the final time we've got with you, though, as far as how you feel this is going to have an impact on individual responsibility.
Yeah, thank you so much. I mean, I think the bottom line is we're going to pay for it one way or the other. And so we can make a choice, and we can let other states take that money, or we could pull that money down into our state and try to make a difference. And I think that, you know, government, I mean, people expect for the pothole to be filled, right? And so, I mean, there is a role for government. We need to be responsible with the taxpayers' dollars. And so that's why we need to be intentional about our government programs, and we need to pay for them if they work. And if they aren't working, then we need to reevaluate those and say, well, I don't know if this is a good idea or not. But the main thing that I think is so important is, if we're going to pay for it one way or the other, then why shouldn't we try to go in and make a difference in somebody's life? I mean, and do it in a caring and compassionate way. I mean, I'm a pro-life person. And for me, the Maternal Life 360 Home is pro-life policy. We are actually going in and working with an expecting mother to try to save the life of that baby. That is pro-life policy, folks. That's a great role for our government to be able to go in and say, hey, let's help you. What can we do to help you get what you need? How can we help you get a better job? How can we help you get to a point where you're really on your feet and you're able then to be a productive member of our society, and then you're contributing with paying taxes, you know, into the system. But let's help you get there. And we know that there's so many folks in the state of Arkansas that struggle. And, you know, I'm tired of kind of seeing us 49th in maternal and infant health outcomes. That's sad to me, because those babies need the chance to be born into a world without huge, complicated health problems that are going to cost us for the rest of their lives. We're going to have to pay for those folks. We need less people on disability. We need more people that are strong, healthy, active, working individuals that are really going to have a life more abundant. And for me, that's what I'm so passionate about with ARHOME, is that it's intentionally designed to bring those things that are important to me, my values, and as a Christian person, it helps us bring all of that to another person and reach them and help them in their lives. And we're going to pay for it one way or the other. I'd rather us try to be intentional and help somebody, because I think that's what we're supposed to be doing, and that's what we're called to do by God.
All right. You've been listening to State Senator Missy Irvin representing District 13. Is that right? Is it
18?
18, sorry.
And I also want to say I stepped away from a gun auction.
Oh.
So I pray that my husband hasn't bought a bunch of guns.
You know, he sent me
I know we bought a bunch of ammunition. So
he sent me a text and said, "Can you keep her tied up 10 more minutes, please?" So he owes me
there's no telling.
he owes me a box of shells. Tell him, okay?
Okay. I hope and pray that we haven't, spent our entire budget.
Oh, well, hey, there's always next week's paycheck. So anyway, all right,
That's the truth. But thank you, and I'm so excited about Les Warren's and a great policy, and that's what I love. All this policy is pulling in the same direction. That's what we're supposed to be doing, and that's great GOP leadership right there.
Missy, I appreciate you being on the Kim Hammer Show this afternoon. I'll see you Monday, and we'll buckle down and get to work. All right.
Thank you, buddy.
Thank you. All right, now we got Representative Les Warren calling in from down in the Hot Springs area. Les, thanks for taking time out to be on the Kim Hammer Show this afternoon.
Absolutely, my pleasure. I'm glad I got to hear you and Missy.
Hey, we've got your bill number is House Bill, what is
1349.
it? House Bill, yeah, and I'm actually House sponsor or Senate sponsor. I should know that. All right, House Bill 1349. And all right, give us the proper title on it, and I'm pulling it up on the website. But what's the proper title?
The Every Arkansan Retirement Plan Opportunity Act.
All right, that's a big old long title. So give us a 100,000-foot view of what it's intended to do.
This is a bill that I got to tell you, in my 5 years now in the legislature, this is probably the bill that I'm most excited to be carrying. This is a bill that is going to establish an opportunity for employers who do not have a retirement plan to offer their employees an ability to use a plan that is going to be set up in the treasurer's office at the state capitol, and any employer who does not have a retirement plan is going to be able to put his company into this plan and offer a retirement vehicle to all of his or her employees. Because one of the things that we have been seeing is, and I'll give you a personal story because this is what really brought this home to me. I had gone to church one Sunday morning, and that afternoon I went to Walmart. And as I walked in, there's this little lady greeting. And she goes to my church, sweet little lady. She was in her early 70s. And I said, "What are you doing here?" And she said, "Honey, I'm having to work." She goes, "I couldn't make it on my Social Security alone." And she said, "I didn't have a retirement plan." And I went on in the store, but it broke my heart because there was a lady in her early 70s that didn't have enough money to stay home and enjoy her golden years, her retirement years. So this plan is helping those who are not saving to save for retirement so that when they do get to retirement age, they can do it. Their Social Security plus what they put back for retirement is going to be enough.
All right. Well, let me ask you, and let me throw you pitches that I know are coming on this one, and then you hit them back. So, isn't that something somebody should be doing anyway without us having to step in and do this, or why is it necessary that we would need to step in and do this? And are there not enough companies out there to do it without us having to have a piece of legislation like this?
Great question. And here is, we started doing research. I'd been working on this. I actually wanted to do it in the last General Assembly, but we really didn't have everything together. So I've been working on this for several years now. But when we started doing the research, what we found out was that we had 530,000 Arkansans who did not have a retirement plan through their employer. So, I mean, that's in a state of 3 million people, I mean, that's 1/6 of the population right there. So we have got a significant amount of our people that basically don't have access through an employer to save. Now, yes, they could go ahead and do something on their own, but what we're finding out is they're not. They get the money in their hands and get their paycheck and they go spend it. What the beauty of this plan is it is a payroll deduction type plan. Nothing about it is mandatory. People, their employer signs up the company, and the people are automatically having 5% of their paycheck deducted, which is reducing their taxable income. They have it deducted, and it goes into a plan, a savings plan, a qualified savings plan for them for retirement. They get a net check. Now then, everybody has the ability to opt out of the plan so that there's nothing mandatory about it. An employer also, if he or she has a great year, they can make a contribution to their employees' plans as well. But they don't have to. Nothing about this is mandatory. But if they want to, they can. So when an employee gets a paycheck, they get a net paycheck with this already deducted. They go spend what's in their hands. I've talked to people and they go, Les, I'm going to spend what I get. And I get it. But this way, the money's already taken out. When we did the research, it said that a person is 15 times more likely to save if they use payroll deduction. So we have set up the best possible plan to get those who are not saving to save.
So why wouldn't employers have a retirement plan for their employees? Because I know some businesses do, some businesses don't. What are the barriers that businesses don't have a retirement plan for their employees?
Another great question, Senator. I have been very, very blessed, but I've worked for big employers most of my life, like Regions Bank or Beach Abstract out of Little Rock is my parent company now. They offer 401k plans, but they have the ability to develop plans. I was fortunate to work in banking, but I did trust work, and I worked with people who were enrolling in 401k plans. I knew one company that set up a plan. The bill for their attorney just to draft the plan was like $30,000. So there is a huge cost, upfront cost, not to mention ongoing cost, the administration of a plan day to day and throughout the year, the testing that has to be done, making sure that you have the investment people investing the funds, making sure that you are in compliance with all ERISA laws. So there is a substantial cost. Many employers don't do this because they cannot afford the cost associated with having a retirement plan. So cost is one of the biggest issues. I even had a representative in the House that came up to me one day when I was trying to get people to sign on as co-sponsors, and he goes, wait. He goes, now, seriously, tell me about this. He goes, I've been wanting to do this for my employees, but I haven't had an avenue to do it. He goes, this is going to be perfect. He has a construction company. He goes, this is going to be perfect for me. I'll be able to sign all my employees up and offer something that I've not been offering. You know, for small companies, it's so hard to offer retirement, to offer insurance at the prices that you have to pay for insurance plans these days. I mean, we're going to give small businesses a tool that they haven't had, an ability to offer a retirement plan for their employees.
So as far as how this would play out, let's say I got the Kim Hammer Show, and I've got 10 employees, and I want to offer this to my employees, and 5 of them say yes and 5 say no. How does it play out in reality as to what I, as a small business of 10 people, which I don't have 10 people, by the way, but if you advertise with me, I might get 10 people. But how is it that you would get that I would do that as a small business owner? Am I just going to deduct for them when I pay their payroll and then send it in, or what?
Okay, perfect question. So first step is that you as an employer will sign up with the treasurer's office, who will hire a third-party administrator to make sure that everything is done right. You will sign up the Kim Hammer Company to be a participant in the Every Arkansas Retirement Plan Opportunity Act. That will then qualify every one of your employees to participate in the plan. Those employees, there will be a person that will come to your business and visit with all of your employees and say, okay, here's what is involved, and we need you to sign up. At that point, every one of your employees can either sign up and tell them exactly what they want deducted. The minimum deduction is 5% of payroll. They can increase that amount or just go with the 5%, or they can opt out. So at that point, every employee will either be enrolled or opt out. So, and from that point forward, each person will have their own account as long as they are employed by you. If they leave your employment, it is a qualified plan, and they can roll it over into another qualified plan wherever they go to work.
So if I get enrolled in this and I work at the Kim Hammer Company for 3 years, and then I got a chance to go to work for the Les Warren Company, and what if Les doesn't have this plan that is going to be parked over at the treasurer's office, but the Les Warren has the standard 401k plan? How does that work out?
Both are qualified retirement plans, and they can roll it into the 401k plan that my company would have.
Okay.
As long as it meets the ERISA, and this plan that we're establishing through the state will meet all the ERISA guidelines and will be a qualified retirement plan that they can roll over to other retirement plans.
All right. Now, some would argue that we are competing against private sector that are already able to do this, and it's going to cut into the private sector. What is the response to dealing with that?
We want everybody competing to get everybody participating in a retirement plan, because what you have happen is when people get to retirement age, one of two things happen. They either have enough money to live on, or they're going to have a handout when they realize they can't make it on Social Security alone. They're going to have a handout either to the government going, hey, I've got to have some type of subsidy, or worse, they're going to be leaning on their family members going, y'all got to help me. I need to live with you, or I need you to give me some money to make ends meet. So what we are trying to do is get these people to be responsible, to start saving now so that they live on their own money. They're self-sufficient when they get to those retirement years. But as far as the taking any business away from anybody that is selling retirement products, I want them to soar. If they get the customers, please do it. Sell them retirement products. Go for it. We don't want to compete. What we want to do is complement. We want to be another option. And what holds so many of these people that we're trying to help holds them back is that it's too expensive for these companies to get a retirement plan started. So we're trying to offer them an avenue that all you got to do is sign up and you're in the plan. But so if any type of insurance, investment financial advisor wants to sell them a retirement product, more power to them. But like I said at the beginning of your show, or beginning of my interview, is that 530,000 Arkansans do not have any money put back for retirement. And another statistic that was really shocking to me, Senator, was that of this group of people who have not planned for retirement, the working person in this group only has $2,500 put back for retirement. The retired person only has $12,000 put back for retirement. Both those figures are not going to go far. They're going to be back to just Social Security, and they're not going to have enough to live on.
The people that would take advantage of this, as far as the employees, are they your what you might call medium wage employees and lower? Is it going to be
Absolutely.
respective of, if I'm working a job that's $80,000-$90,000, chances are I'm probably working for a company that's got a plan.
That's true.
But
True. So,
this is targeted more to the lower income people.
Lower income and small business that they're making a good business go, but they just don't want that extra expense of a retirement plan.
Or can't afford it.
That's right. And, so we are trying to offer those who do not have it, don't want the expense, can't afford the expense, an alternative to get their employees saving for retirement. So we think we've got a plan that complements what's out there. And we are excited to be able to offer it, but we think it's something, and I'm telling you, I visited with trust departments, I visited with bankers, I visited with Stevens Inc. I've got friends that work there, largest off-Wall Street investment firm in the country, at least they were, and they're all saying that that's not a market we go after. These are people who are not being asked to invest for retirement. We need to take care of these people so that they can take care of themselves, and they're not asking the government to take care of them when they get into retirement years.
All right, I'm down to 2 minutes. Let me make a couple comments, too, if I remember right from our discussion the other day. If they build up a pretty good nest egg in this, they have the ability at a certain point to roll it over and go into a different plan. This is really just a starter vehicle to get them in the business of saving toward the retirement. And should they get an accumulated amount in there of significance, then they would be able to take it and move it to somewhere else. Is that right?
That's right. We because I was a banker, I wanted to basically make this something that was good for the state as well. So we made this like an incubator program. If a company with all its employees grows to like a total aggregate balance in the account of $600,000 or more, they have to go start their own plan. And then those in the market can go bid on that business that we've grown within our plan.
Which is why a lot of the big boys aren't complaining about this, because it actually creates a market for them down the road. All right.
They were thrilled. They go, wow, you were doing an incubator program that could help us down the road.
Cool. All right, I've got to go. We've been listening to Les Warren, State Representative out of the Hot Springs area. He is the primary sponsor on the House side, House Bill 1349. Go up there and check it out. I would also say this. If you look at the bill, it is a bipartisan bill with a significant number of sponsors. It's a good thing for you to take a look at, especially if you own a small business. Remind you about the Murphy Production Gun Show down in Benton today till 5 o'clock, tomorrow till 4 o'clock. You've been listening to the Kim Hammer Show. Thank you, and look forward to seeing you next Saturday here on 101.1 FM, The Answer on the Kim Hammer Show.
101.1 FM. The Answer. KDXE FM. Kamak Village, Little Rock. A Salem Media Group station. 101.1 FM. The Answer.